Every year, millions of people around the world experience a stroke. It remains one of the leading causes of death and the most common reason adults are left with long-term disabilities. What many people don't realize is that in many cases, the brain sends warning signals before a major stroke occurs. These signs may appear hours or even days earlier, giving you a valuable opportunity to seek medical attention before permanent damage happens. A stroke is often thought of as something that strikes without warning, but that isn't always true. In many situations, it is the final stage of blood vessel damage that has been developing silently for years. Understanding the early warning signs can make the difference between a full recovery and lifelong disability. There are two main types of stroke. The first is a hemorrhagic stroke, which happens when a blood vessel inside the brain ruptures and bleeding damages nearby brain tissue. The second and much more common type is an ischemic stroke. This occurs when a blood vessel becomes blocked, cutting off oxygen and nutrients to part of the brain. Within only a few minutes, brain cells begin to die. Although your brain makes up only a small percentage of your body weight, it uses an enormous amount of oxygen and glucose every single minute. Because of this constant demand, even a brief interruption in blood flow can quickly cause permanent injury. This is why doctors often describe stroke treatment as a race against time. The blockage responsible for a stroke usually doesn't appear overnight. It develops slowly as cholesterol deposits, inflammation, and blood clots gradually narrow the arteries supplying the brain. Before a complete blockage occurs, the brain may briefly lose blood flow and then recover. These short episodes are known as transient ischemic attacks, or TIAs, often called mini-strokes. A TIA may last only a few seconds or several minutes before symptoms disappear completely. Because people often feel normal again shortly afterward, many ignore these warning signs. However, a TIA should never be dismissed. Research has shown that many major strokes occur within the next few days after one of these temporary attacks. In other words, the body may be giving you a final opportunity to prevent a much more serious event. One of the earliest warning signs is temporary vision loss in one eye. Some people describe it as if a dark curtain suddenly covered their vision, or as though everything became cloudy or gray. The episode may last less than a minute before normal sight returns. This usually happens because a tiny blood clot or a fragment of plaque briefly blocks the artery supplying the retina. Even though vision comes back, the same clot could later travel into an artery inside the brain and cause a much larger stroke. Temporary vision loss should always be treated as an urgent warning sign rather than ignored. Another common warning sign is sudden numbness or tingling affecting only one side of the body. It may involve the face, one arm, one leg, or an entire side. Many people describe the feeling as pins and needles, heaviness, or a sensation that the limb doesn't belong to them. Unlike numbness caused by sleeping in an awkward position, this type appears without any obvious trigger and usually disappears within minutes. The problem isn't in the arm or leg itself. It is caused by a temporary interruption of blood flow to the part of the brain responsible for sensation. Whenever numbness appears suddenly on only one side of the body, medical evaluation should not be delayed. The third important warning sign involves balance and coordination. Imagine walking across a room when, without warning, your legs suddenly feel weak or unstable. You may stumble, drift to one side, or feel as though you're intoxicated even though you haven't consumed alcohol. Some people experience an intense spinning sensation that forces them to grab onto furniture for support. These symptoms can occur when blood flow to the cerebellum, the part of the brain responsible for balance and coordinated movement, is briefly interrupted. This area constantly helps your body maintain posture, control movement, and stay upright. Even a short reduction in blood supply can cause sudden dizziness, poor coordination, or difficulty walking in a straight line. While dizziness can have many harmless causes, sudden, severe dizziness combined with trouble walking or maintaining balance should never be ignored. It may represent a transient ischemic attack affecting the back of the brain. The fourth warning sign involves speech. Everyone occasionally forgets a word or loses their train of thought when tired or stressed. That is perfectly normal. What is concerning is a sudden inability to speak clearly or understand language. Some people know exactly what they want to say, but find that the words come out slurred or broken. Others may speak fluently, yet their sentences make little sense, or they may struggle to understand simple conversations. These changes occur because specific language centers in the brain temporarily lose their blood supply. Even if speech returns to normal after only a few minutes, the episode should be treated as a medical emergency. Temporary recovery does not eliminate the underlying problem. Instead, it may be a warning that a much larger stroke could soon follow. The fifth warning sign is less widely recognized. Some researchers have explored a possible association between autoimmune conditions, such as vitiligo, and an increased risk of vascular disease. Vitiligo causes patches of skin to lose their normal pigment because the immune system attacks pigment-producing cells. Autoimmune diseases may also contribute to chronic inflammation inside blood vessels. The inner lining of every artery, known as the endothelium, normally provides a smooth surface that allows blood to flow freely. When this lining becomes damaged by inflammation, high blood sugar, smoking, or other risk factors, cholesterol and inflammatory cells can accumulate more easily, gradually forming plaques that narrow the arteries. Vitiligo alone does not mean someone will have a stroke. However, if a person develops unusually severe headaches that are different from their normal pattern, especially when combined with other neurological symptoms, it is important to seek medical evaluation rather than assuming the headaches are harmless. Headaches themselves have many possible causes. Neck arthritis, muscle tension, disc problems, and migraine disorders are all common explanations. Because of this, headaches should always be interpreted in the context of other symptoms instead of being viewed as proof of a stroke by themselves. To understand stroke prevention, it's important to know what damages blood vessels over time. Many people believe that having a normal cholesterol level automatically protects them from stroke, but the health of the artery wall is just as important as the cholesterol circulating in the bloodstream. One of the biggest threats to healthy arteries is chronically elevated blood sugar. Glucose provides energy for every cell in the body, but when blood sugar remains too high for long periods, it gradually injures the delicate lining inside blood vessels. Over time, damaged areas become ideal locations for cholesterol deposits and clot formation. This process often begins years before diabetes is officially diagnosed. Even prediabetes can silently contribute to blood vessel injury, making early detection and proper management extremely important for reducing future stroke risk. Another major contributor to stroke risk is smoking. Every cigarette exposes your blood vessels to harmful chemicals that trigger inflammation and gradually damage the protective lining of the arteries. Smoking also increases the tendency of blood platelets to stick together, making clot formation much more likely. When damaged arteries and sticky blood combine, the risk of an artery becoming blocked rises significantly. Blood pressure also plays a critical role, although many people misunderstand how it affects stroke risk. Long-term high blood pressure places continuous stress on artery walls, accelerating plaque buildup and weakening blood vessels throughout the body. Over many years, this greatly increases the chances of both ischemic and hemorrhagic strokes. However, there is another important detail. If an artery is already severely narrowed by plaque, a sudden drop in blood pressure can sometimes reduce blood flow enough to trigger an ischemic stroke. Blood pressure naturally falls during sleep, which may help explain why some people go to bed feeling perfectly well but wake up with stroke symptoms the next morning. Age is another factor that influences stroke risk. Although strokes become much more common after the age of 50, younger adults are not immune. A meaningful percentage of strokes occur before age 45, often for different reasons than those seen in older adults. In younger individuals, congenital abnormalities of blood vessels, inherited clotting disorders, autoimmune diseases, neck injuries, and certain heart conditions may all contribute to stroke risk. As people grow older, plaque buildup, hypertension, diabetes, and abnormal heart rhythms become increasingly important causes. If you ever experience any of the warning signs discussed earlier, even if they disappear within minutes, you should treat them seriously. A transient ischemic attack may represent a narrow window during which doctors can identify the cause and reduce the risk of a major stroke. Whenever possible, avoid being completely alone after a suspected TIA until you have been medically evaluated. If a larger stroke develops, another person may be able to recognize the symptoms quickly and call emergency medical services without delay. Driving yourself is also discouraged after experiencing temporary neurological symptoms. Sudden vision loss, weakness, or difficulty speaking while behind the wheel could place both you and others in immediate danger. If blood pressure is extremely elevated, for example, around 180 over 110 millimeters of mercury or higher, and especially if it is accompanied by stroke symptoms such as weakness, speech difficulty, confusion, or vision changes, emergency medical care should be sought immediately. Healthcare professionals can determine the safest treatment based on your specific situation. One of the most important points to remember is never to begin taking blood-thinning medications on your own after developing possible stroke symptoms. While certain medications can reduce clot formation in ischemic stroke, they may dramatically worsen bleeding if the stroke is actually hemorrhagic. Only brain imaging performed in a hospital can reliably determine which type of stroke is occurring. While waiting for emergency medical care, remaining calm and avoiding unnecessary physical exertion is important. Medical professionals will provide the most appropriate treatment after evaluating your symptoms and performing the necessary imaging studies. Even if no further symptoms occur after the first episode, follow-up evaluation should not be skipped. A temporary recovery does not eliminate the underlying disease process. Instead, it may simply mean the body has provided an opportunity to prevent something much more serious. After experiencing symptoms that could indicate a transient ischemic attack, your healthcare provider may recommend several tests to identify the underlying cause and estimate your future stroke risk. One of the most valuable examinations is a carotid duplex ultrasound. This painless, non-invasive test evaluates the large arteries in your neck that carry blood from the heart to the brain. Unlike a standard ultrasound, duplex imaging not only shows the structure of the arteries, but also measures how blood is flowing through them. If significant narrowing is discovered, especially when an artery has lost a large portion of its normal opening because of plaque buildup, blood flow to the brain may become dangerously restricted. In selected patients with severe narrowing, doctors may recommend procedures designed to restore blood flow and reduce the likelihood of a future stroke. The exact treatment depends on the location of the blockage, its severity, and the patient's overall health. Another important evaluation is the HbA1c blood test, also known as glycated hemoglobin. Rather than measuring blood sugar at a single moment, this test estimates your average blood glucose level over the previous 2 to 3 months. This makes it extremely useful for identifying people who may have undiagnosed prediabetes or diabetes. Even mildly elevated blood sugar can slowly damage the inner lining of arteries over time, increasing the risk of plaque formation and future cardiovascular disease. Detecting abnormal blood sugar early allows treatment to begin before serious complications develop. Doctors may also recommend extended heart rhythm monitoring, commonly performed with a portable device known as a Holter monitor. Unlike a routine electrocardiogram that records only a few seconds of heart activity, a Holter monitor continuously records the heartbeat for an entire day or longer. This longer recording increases the chance of detecting abnormal heart rhythms that come and go throughout the day. One of the most important is atrial fibrillation, often called AFib. In atrial fibrillation, the upper chambers of the heart no longer contract in an organized rhythm. Instead, they quiver irregularly, allowing blood to collect and swirl inside the heart. When blood remains stagnant, clots can form. If one of those clots breaks loose, it can travel through the bloodstream into the brain, blocking an artery and causing a stroke. Many individuals with atrial fibrillation experience few or no symptoms. Others may notice occasional fluttering in the chest, skipped heartbeats, shortness of breath, or episodes of fatigue that they mistakenly attribute to stress or aging. When atrial fibrillation is diagnosed, physicians can recommend treatments that greatly reduce the chance of stroke. These may include medications to control the heart rhythm or medicines that reduce the likelihood of clot formation when appropriate for the individual patient. The important message is that stroke is rarely a completely random event. In many people, the body provides warning signs before a major attack occurs. Recognizing those signals and seeking prompt medical attention may prevent permanent brain damage and save lives. The most effective way to reduce your risk of stroke is not to wait until symptoms appear. Prevention begins years before a medical emergency ever occurs. Keeping blood sugar within a healthy range helps protect the delicate inner lining of your arteries and slows the development of plaque. If you have risk factors for diabetes, regular screening and early treatment can significantly reduce long-term damage to your blood vessels. Managing blood pressure is equally important. Work with your healthcare provider to keep your blood pressure within the range that is appropriate for you. Consistently controlled blood pressure lowers the risk of both blocked arteries and bleeding inside the brain. If you smoke, quitting is one of the most powerful decisions you can make for your health. The body begins repairing damaged blood vessels soon after smoking stops, and over time, the risk of stroke declines substantially compared with continuing to smoke. Regular physical activity, a balanced diet rich in fruits, vegetables, whole grains, lean protein, and healthy fats, maintaining a healthy body weight, limiting excessive alcohol intake, and getting adequate sleep all contribute to healthier blood vessels and a lower risk of cardiovascular disease. It is also important to attend regular medical checkups, especially if you have conditions such as high blood pressure, diabetes, high cholesterol, heart disease, or a family history of stroke. Monitoring these conditions allows treatment to begin before serious complications develop. Above all, never ignore sudden neurological symptoms simply because they disappear quickly. Temporary vision loss, weakness, numbness on one side of the body, difficulty speaking, severe balance problems, or sudden confusion should always be evaluated urgently by a healthcare professional. If you ever experience symptoms that could represent a stroke, remember that every minute matters. Immediate medical assessment offers the best opportunity to protect brain tissue, preserve independence, and improve long-term recovery. The information presented here is intended for educational purposes only and should never replace personalized medical advice. Every person's medical history is unique, and the most appropriate evaluation and treatment decisions should always be made together with a qualified healthcare professional. Understanding the warning signs, recognizing your personal risk factors, and acting quickly when symptoms appear can make a life-changing difference. Early action saves brain cells, preserves function, and in many cases, saves lives.